Good morning.
Hi.
I'm Dr. Gallagher.
Hi, I'm
This
Michelle.
This is my medical assistant, Kim.
Hello.
It's nice to meet you this
Nice to
morning.
meet you.
Why don't you tell me in your own words what your chief complaint is? Why are you here today?
Well, I'm here today because I've had 4 children,
Okay.
and it started after my second varicose veins in my legs. So they're painful and kind of ugly. So I want to be able to wear shorts and not feel so much discomfort at the end of the day.
The treatment for this, I think you had mentioned on the form that you've tried to use compression therapy to
Yes.
treat this, and it really hasn't helped much.
It has
Okay.
not.
So with respect to what's going on in your left leg, there's no question that there's a simple, minimally invasive operative procedure that we should consider doing to treat that. With respect to the spider veins in your right leg, that's treated with a procedure called sclerotherapy. Everything you need done on the left leg is usually covered by insurance. Sclerotherapy is considered by the insurance companies to be cosmetic, even though we know that the spider and reticular veins can cause pain and be unsightly. It's still considered a cosmetic procedure. So let me just tell you how this happened, okay?
Okay.
As you know, the arteries bring the blood to the legs and the veins take the blood back to the heart. The way the blood gets back to the heart is when you walk, your calf muscle squeezes the vein and sends the blood up to your heart. But gravity wants the blood to come down, so you have valves in your veins. So when things work right, the calf muscle squeezes, the valve opens, the blood goes up toward your heart, tries to come down, and the valve closes. That's the way the blood gets back to the heart.
Okay.
That's why the calf muscle is called the peripheral heart, okay? In your leg, you have 2 systems. You have the deep venous system and the superficial system. The deep veins are the larger veins that are close to the bone that account for about 90% of the blood flow from your legs to your heart. We're going to be checking that out in a few minutes. I'll tell you about that. What I just checked on you is the most common cause of varicose veins in your left lower extremity.
Okay.
There are 2 major superficial veins that we look at. We look at the great saphenous vein, which is the longest vein in the body that runs from the ankle all the way up to the groin. And the short saphenous vein runs from behind the knee to the outer ankle, okay?
Oh, okay.
Now, in your left leg, what we've already discovered is you have a very typical presentation. The portion of your great saphenous vein in the left thigh is incompetent. That means that every time you stand up, you have reflux of blood going from your heart, refluxing down through your great saphenous vein from the groin down to these branches which have bulged out and become varicose veins. So we've discovered the cause of the problem and the problem itself, and they both need to be treated.